speaker is Joey. Thank you, Joey.
Good morning, everybody. Did you hear my voice?
Yes.
Although it's not great.
You can speak louder.
Yeah, I try to speak up. Good morning, everybody. My name is Chit, as you all know me. And I'll just talk about my background. I was working as a maxillofacial nurse in the Canterbury Hospital and a dental nurse, dental radiography nurse in King's College. The reason why it brought me into this job is just to find that, I've been a lot of experience in the hospital, and I can see that, some of the oral health diseases you can't help, but we can actually do something about it. But it's just dentists haven't got time, and the dental nurses spending their time in the surgery assisting the dentist. They don't even have time to talk to the patient. So that's why I come to this job, and I'm hopefully all the messages will spread across not just London, it will be across all over in London or my town, Kent, hopefully. So therefore, this is my little project just to raise up our profile for our team, because I found that a lot of time when we go out, people don't know what oral health promotion do. And some of the people in the trust, they don't know that the team is actually exists. So, as I said about the background, and then next one, I'm going to talk about the objective. Because, as I said, we need to have oral health matrices consistent. Because for example, if you're a patient, if you're getting different messages from different health professionals, what do you feel? You just feel whether we are actually giving the right thing or who you should be listened. That's why we need to make sure all people, and even the health professional, have received the right messages about dental health. Obviously, the dietary requirement, we need to look into it, because a lot of time you may not notice about the sugar and acidic that we had in the food and drinks is actually affect our oral health as well. And the oral hygiene, people, yes, they do brush twice a day, but they don't know when they need to brush. Maybe they know, but they didn't do it properly. Like, between when is the best time to use the mouthwash? Is it right after brushing or before or another time? They don't know about it. And also the fluoride concentration, because unfortunately on the market, wherever you go, even though not just the dental products and the food and drinks you bought from Tesco or other the big supermarkets, all these packaging, they're very confusing. And this is what we need to raise awareness to let everybody know about this information. And also, you may be not aware that a lot of people, they may not be into the dentist at all. That's what we want to do through oral health promotion, just to encourage people that is the need. Obviously, this is additional to the oral daily hygiene, but this is essential to go to the dentist. And dentists, they are not horrible. They are very friendly. Right, it's a little bit statistics here. It's not going to be boring after this slide. This is just to show you, this is the dental decay experience across CLCH boroughs. Although we have if the black one shows the statistic in 2007 to 8, and the pink one is 2012 and 13. Although we have such a big, huge, significant improvement over the last 5 years, but we still need to do it better. And what the outcome is, once we launch out, raising awareness of our team, and hopefully we would like to get all the messages and the right training across the CLCH, and also for the service users. And also, because as probably some of you know here, that we will run some oral health program at schools and other settings. And sometimes it's very difficult to get positive consent. And this project, I would like to aim for at least 70% of positive consent for all the programs we're going to run. And also the leaflets will hopefully can be downloaded on a website as well. So the action plan is actually still in process, and it will be launched fairly soon next year. So what's my action plan is, I already set up the generic email so that everybody will just go to ohp@clch.hs.uk just to get in touch with me, because we are altogether 6 people in the team. And it's very difficult to remember all around name, how to spell it in case send it to the wrong person. So the generic email is essential as a team. And also, I'm going to set up the contact number as a team as well. But, it haven't been done yet because we'll be moving in Soho. So during this transition period, I better not to hold on with it, not to do something until we finally move into Soho. And I'm trying to organizing an ORHP hub on the internet so that you could get whatever training we do, any health events that you could come along, and also briefly oral health messages and leaflets can be downloaded so that you could just download it and it will save the cost for the trust and for our department, because if we're going to print out loads amount of leaflet and you request from us, it may ending up, you may not using it or you may waste it. It will be good if you could just download it and give it to the service users. An external website, again, it will be similar sort of thing, but it won't have the leaflets. It will be basically some activity sheets they can download, like brushing charts or any coloring sheets that the parents can download for their kids so that they could brush the teeth while they're doing something, or just talk about the oral health and other dental-friendly diet. And training is still in process. All the proposal is already sent off to L&D to be to wait. I'm waiting for approval really. And there are 2 courses we'll be running for the staff. And level 1 will be applied for everybody, and it could be a reception or cleaner or administrator, or even though nurses can go on. It's applied for everybody, and there's no banding bound. So it's just the information, very brief key messages of oral health and other things that you need to know for yourself. And hopefully, if you're day-to-day patient-facing, you'll pass the message on. And the level 2, we targeted to those people that we have a very close relationship within the trust, like school nursing, school health technicians, dietetic and nutrition teams, and speech and language therapists. Well, yes, and hopefully district nursing, or any other professional face-to-face. Team building, I very like Valen, but your team building is great. And also, I would like to add up in team building, apart from getting together, being proactive, and and make people work. I think it's really crucial to get people go outside of work and gathering together, so that you know the person from inside of work and outside work. Any other question? I'm finished. Any questions? No? Thank you. Huh? No.
With the oral, because you don't hear a lot of it when you're working in CLCH.
Yeah.
Would it be an idea, or could you just come along, whether you work in dentistry or in the oral section? Or not? I mean, I'm admin
for the training, yes, you can. Yeah, the level, yeah.
Thanks for your, because I'm about to go and start one of my things. But the main thing is, most of your leaflets, are they on the hubs or on the website?
On the hub.
On the hub.
On the hub.
So we can download some of your
leaflets, yeah.
Thank you.
Yeah.
So, Joe, other than leaflets and stuff, is there any other stuff that you could give to the children when you go out to schools? Like
You can contact us and borrow it.
Oh, okay.
Yeah.
Cool.
Yeah.
Brilliant.
Any other questions? No. Thank you.
Thank you very much.
Thanks.